We are all counting down to 2021, and hopefully it is going to be a much better year. The vaccine, of course, giving so many of us hope that we are on the backside of this pandemic. And to talk a little bit more about this experience in COVID-19 and the crisis, we are joined now with Eric Wallis. He's the president for the Henry Ford West Bloomfield Hospital. Thank you for being with us as always.
Thank you so much for having me this morning.
So have you all received a portion of an allotment of the vaccine there at the hospital?
Absolutely. So last week we received about 1,000 doses of vaccine. And then again, yesterday, we received a second shipment of, again, about 1,000 doses. And so we are off and running and working really hard to get our team members here at the hospital vaccinated.
So what is your plan for the distribution amongst your employees?
Yeah, so again, the great part about being part of the Henry Ford Health System is that we've got a lot of resources, and we're working hard with our sister hospitals to make sure we kind of have a similar plan. And so across the system, we actually developed a kind of a tiering process that followed the CDC's guidelines. We work very closely with the Michigan Department of Health to make sure that we're following their guidelines. And as you would expect, we kind of started with folks who are at the highest risk of being in contact with COVID-19 patients. So we started with our ED team members, folks who work in our ORs, our ICUs, et cetera, to make sure that they get the vaccine first. But the really great news is that we are already almost through our first phase of vaccinations, and we're already starting into phase two, which is a lot of our other direct patient caregivers here within the hospital.
That is really amazing when you think about the magnitude that this has all happened, because it was just mid-March, that we, started to detect COVID here in the States. And within a year, there's already a vaccination.
Yeah, I think that one of the things that probably hasn't been publicized as well as it needs to be is that the mRNA technology that is being used in both the Pfizer and the Moderna vaccine is actually relatively old technology. It's been around for 20 plus years. It just hasn't been necessarily used for a virus yet, or a vaccine yet. And so that helped. And then, frankly, the foresight of the federal government to have those companies start to actually manufacture vaccine prior to them receiving approval cut months out of the process. And so that really has been a significant help in this, and really helped to get us here. So I think one of the things that we want people to hear is that, sometimes folks get worried that, gosh, it seems like they cut corners to get these approved, and they really did not. What we changed is, instead of doing things in sequential process, things were done in parallel, so that you don't have those waiting periods.
So we are still in the middle of an upsurge of the virus and the number of people needing help from the hospitals during this time. And now we're going into the Christmas holiday season. You saw the images on the news where the airports once again were packed as people are choosing to travel. How is your staffing there at the hospital right now?
Staffing is okay. We're in a place where we've kind of been in this mode for a while now. And so again, being as part of a health system, we've got resources that we're pulling from kind of multiple different parts of the organization to help and support our frontline team. And so, I think as we go into the holiday season, the hardest part is that this is usually a time where folks look forward to, getting a little break and, being able to rest and relax before we start into the next year. And really, we're not going to have that opportunity this year. We're still kind of going full guns forward here, and so our staff is tired. We're very much looking forward to this vaccine to hopefully be a place where we can see a break coming, and everybody get a chance to just stop and relax. But it's going to be a busy holiday season. I'm grateful to the people of Michigan and the governor and some of the orders that have gone out. With some of the pause that was put in place, because it does seem like that has helped. We've seen the numbers go down in the last couple of weeks. And so I'm hopeful that folks will heed those concerns and warnings here over the Christmas holiday as well. And we won't see another spike, in the 2 weeks after Christmas.
So this time of year, there are typically other injuries as well that need hospitalization care, such like if we get a snowstorm or accidents and car accidents and ice falls, things of that nature. Are you concerned, or should the public be concerned about, what is available in the hospital and the staffing levels if they need to address those emergency care issues?
No, that's a great question, but honestly, not at all. We continue to tell folks, if you need care, please come. We have the resources we need. We've got everything open and running. We continue to do elective procedures and surgeries. I'll be the first person to tell you that I've got a family member who next Monday is going to have a knee replacement here in the hospital. And so, we still are here to serve the community, and we don't want people to delay care if they need it.
Yeah, because we saw that in the beginning of the crisis.
Mm-hmm. Absolutely. And for many people, some of those delays were okay. For some folks, though, cancer doesn't stop. It doesn't sit and say, hey, gosh, I know you got a pandemic going on, so let me hold off progressing here. We still want people to get their routine care. We still want people to get their screenings. We're still here to do elective procedures if this is a good time of the year for you to do that. And the great thing about the West Bloomfield Hospital here is we have all private rooms. We've been at this for 10 months. We know how to keep people safe. We know how to keep people in good environments. We've kept our team safe. And so you couldn't walk into a safer place right now.
You're listening to 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills. Joining us now, Eric Wallis. He's the president for the Henry Ford West Bloomfield Hospital. There is some great news in the middle of this crisis coming out of the hospital with the new mental health hospital and the plans to build that. Can you touch on that topic just a little bit?
Absolutely. I think everyone knows and understands that the mental health needs of not just our community, but across Southeast Michigan as a whole have been very much underserved. And so our health system is very proud that we are partnering with a company to actually build a brand new acute care psychiatric hospital here on the West Bloomfield campus. We're hopeful that that'll be completed in just a couple of years. We've taken the first steps, but you're looking at what will be almost a 200-bed inpatient psychiatric facility to serve that very pressing need here in our community. So it's a really great day. We've had great partnership with the West Bloomfield Township leadership and the health system leadership. And so it's exciting that we're seeing this great addition to our community.
It is desperately needed in the state of Michigan as well. And we are seeing the cases and the need for mental health services rise during the middle of the pandemic.
Yeah, you're absolutely right. I think that, we all know that for 10 months now, we've been in a place of isolation where folks don't have their normal relationships to lean on. They don't have, normal patterns of going to work, staying home, seeing friends, and that's taken a toll on folks. And so to be able to bring services here to the community, we've already been blessed that we have our Maple Grove facility that really helps to treat folks with substance abuse. And so we saw this as really just a natural addition to the campus here. And again, it's going to be a great beacon of light for folks who need kind of behavioral health services.
So how do some of these mental health issues fall over into the emergency room needs there at the hospital?
Yeah, I think, unfortunately, because there aren't a lot of services that are available to folks in this population, sometimes they get to the point where, the place of last resort is coming to the emergency room. And so our EDs do get burdened with folks that come in and really just need help. And the unfortunate thing is that, our emergency departments really aren't designed. They're not the best place to get behavioral health care. So we kind of get in the same place where we're a little bit sometimes in a holding pattern trying to find one of the very limited resources to help our patients. And so again, to have that resource here on the campus, we'll take that burden and we'll be able to direct those folks to get the care that they need and be able to stay local as well.
Well, it's great that you're able to pull this project off in the middle of the pandemic. I know it's going to be a while to actually get built and to be a service of the community, but I would imagine your budget's probably pretty tight right now.
Yeah, it's been a tough year, and I think as we look at projects that are going to go forward, some projects are going to be delayed. The priority and the need of this, I think, kind of pushed it to the top of the list. And so the resources that we do have, I think it's a great place to spend them. We're grateful as a health system that the funding that came from the federal government earlier this year as part of the CARES Act made a big difference. We're still going to be way behind where we expected to be, but we're going to be in a place where we're still going to be able to deliver care. We're still going to be able to be here and support the community, and the inpatient facility, psychiatric facility is going to be one piece of that commitment back to the community for the help that we've received.
So DC, the latest CARES Act bill is still in the midst of the decision-making process in DC. We won't even get into that, but do you anticipate that your hospital and your hospital system is going to be able to benefit from that bill if it does in fact get passed?
Yeah, I would say that the help that's within this latest version of the legislature is minimal to acute care facilities. We certainly, I think there are a few things both in the federal package and a few things in what was recently passed here in the state of Michigan that will help, but they're certainly not to the magnitude of what we saw earlier in the year. And so we're always thankful for the support that we get, but I don't think that this is going to be, necessarily a game changer financially for us based on what's currently in that legislation.
So if we can go back to the conversation about the vaccine just a little bit, are you currently utilizing the Moderna or the Pfizer vaccine, or is it a mixture of the two of them?
No, so we were, thinking ahead back in the summer and looking at the vaccine candidates that were coming forward. And so very early on, we purchased some of the freezers that can keep those kind of super cold temperatures. And so our first distributions of vaccine have been the Pfizer vaccine. We do not at this moment expect to get the Moderna vaccine. We're seeing that is going to be kind of directed toward facilities, organizations that can't manage the super cold temps that the Pfizer vaccine needs. And that's okay. I think, there's very thoughtful work going into making sure that this vaccine gets spread out as much as it can to benefit as many people as it can. And so right now, as our health system, our hospital, we're expecting we're going to continue to get the Pfizer vaccine and be managing that, and that, ambulatory sites, doctors' offices, health departments, et cetera, are going to see more of the Moderna vaccine, and it's going to go to them because they don't have to manage that extreme cold chain that the Pfizer vaccine needs.
So how many employees do you have there at the West Bloomfield branch?
Yeah, so here on our campus, there's about 2,000 employees here. Across our health system, we have about 33,000 employees. And so, to date, as of, I think, noon yesterday, we've done about 5,000 vaccinations across our health system so far.
How long do you anticipate that it's going to take you to get through your entire staff? And are you requiring it at this point, or is it just on a volunteer basis?
So we're not requiring it. I think there's still some questions that we have, and we think that the vaccine has a great efficacy. We're very excited that the vaccine in its trials has shown very low rates of side effects, but I don't think that we felt that we're to a point where we wanted to require the vaccine. We've done a lot of education of our team members. In our first wave, as we've sent out notifications that people are eligible to be vaccinated, we're seeing about a 75% response where folks are saying yes, they want to be in it. And honestly, a lot of that 25% is kind of in the, I want to see a few folks get it before I jump in. And so it's been really, really, really great to see that high level of folks that want to be part of this first wave. Right now, if we continue with our supply of vaccine the way it has been the last 2 weeks, we're really expecting that by the end of January, we'll have our entire team vaccinated.
Wow, that is pretty amazing. I will say, I think about the nurse who got the vaccine and she was fine for a second and then she fell out in front of all of the cameras. Have any of your staff members had any type of side effects from getting the vaccine?
Yeah, so we really have not had anyone have side effects from the vaccine. I think even the nurse that you're referencing to, it really was what we call a vasovagal reaction, and it's somebody who doesn't like getting a shot anyway. And so, there are people that kind of bear down or and it kind of makes them pass out. So, I think most of us know friends or family members who do the same thing at the sight of blood or, gory movies that, kind of makes you kind of queasy. So that's really, I think we've had one of our team members that had the same thing and told us even before, hey, when I get shots, sometimes I kind of have that kind of reaction. So we've not seen any significant reactions to the vaccine. Many of our team members and providers have gotten the vaccine, and I'll tell you, it's a little bit like the flu shot. You wake up the next day, your arm's a little bit sore, but it really does go away in 24 to 48 hours. So it's something that's exactly as we said. Right now, what the trials told us is less than 2% of people after the second dose have a reaction that's strong enough that you might need to miss work. And so we're planning for that and telling folks that they may want to think about getting their second dose of the vaccine before a day off, so that they don't have to necessarily come to work if they're not feeling well. But universally, it resolves itself pretty darn quickly.
How many members do you have out right now due to COVID or are in quarantine? Do you know?
Yeah, so we probably on our campus have 20 to 30 folks right now that are out. Almost all of those, actually all of those are community acquired cases of COVID. So, we've been tracking very carefully any exposures that we have at work. And to be honest with you, outside of the first 2 weeks, when we were all learning how to take care of these patients and didn't know what the right PPE was, et cetera, we've really not had anybody get exposed while at work. And so that's been a great story for us as we've gone through this. It's trying to manage what our folks do when they're outside of work that sometimes is a little more challenging.
Eric Wallis with us here on the Oakland County MegaCast. He's the president for Henry Ford West Bloomfield Hospital. Just another minute or two left with you here on the MegaCast. Anything maybe I didn't touch on that you want to share with our listeners and viewers before we let you go?
Yeah, no, again, I think there's a lot of sources of information and or misinformation around the COVID virus, the COVID vaccine. I really just would encourage folks, if you go to henryford.com, we've got a couple of web pages there that have all kinds of great information about both the virus and the vaccine. There's the top 10 myths. There's things that you should know, things that you should ask your providers. We've had a lot of questions about folks who are pregnant and whether or not they should receive the vaccine. I believe the CDC has come out and said there's no reason that folks who are pregnant or breastfeeding shouldn't take the vaccine, but you probably should have a conversation with your primary care doctor or your OBGYN before you get the vaccine, but it's safe. And so really just encourage folks, go to henryford.com. There's a great source, a lot of resources there to help answer your questions.
But you understand the confusion or the hesitancy from some people in the public because, back in the beginning of this, there was so much confusion surrounding decision-making, like wear a mask, don't wear a mask, do this, do that, wipe your, packages down. You don't have to wipe your packages down. And we understand it's a new virus and it's a learning curve and a learning process, but this vaccine is new as well.
Yep. Oh, no, absolutely. And I think you're spot on. Anytime that you have something that has never been seen before, we're going to learn as we go. And I think that the important part is to stay up to date. That just because something is one way today doesn't mean it's not going to change as we scientifically learn more as we go into the future. There are places that are reputable resources. And I think we've tried to be very transparent with folks when information changes, when practices change. And so I always beg folks for a little patience because as we learn new things, we want to put it out there and make sure everybody knows what we know. And so it's probably going to be an evolution even over the next couple of years as we learn how long the vaccine is good for. Do we need to get it again every year, or is it something that's going to protect us for numerous years? Right now, we're learning about a variant of this virus and what it's going to look like. So it's going to be an evolving process, I think, for a number of years yet.
But as someone that's been there and you've seen the devastation of this virus, do you feel like the vaccine is the end of this crisis?
I think it's the beginning of the end, and the key is to get enough people to get vaccinated. We've got to reach that 70, 80, 90% of folks that have protection. Even at 95% protection, what that means is 1 person in 20 is still going to get COVID even if you've been vaccinated. And so what we really got to do is we've got to get enough people vaccinated to reduce that possibility that you're even going to come into contact with someone. Just for reference, when you start talking about 95% protection, that's like the measles mumps and rubella shot. These are diseases that we haven't seen in this country in decades because we got enough people vaccinated. And so that's really what we're trying to accomplish.
Well, it's always great having you on to answer these questions for us. We appreciate your time.
Well, no, absolutely. Thank you, and happy to come back anytime.
Well, thank you. And please extend our holiday wishes to you and your entire team. And again, thank you to all of your team members over there and everything that they do for our public and all of us to try to keep us safe during this time.
All right. Thank you so much, and happy holidays to everybody.